This segment is all about treating sagging neck skin or droopy skin under our chin. This is something that virtually everybody, once we hit our early to mid 50s, has to deal with, and sometimes even earlier. Now, there are some options of treating sagging neck skin that don't involve surgery, but first let's talk about what exactly causes the droopiness of our neck. Now, the droopiness of our neck is typically caused by three different things. First thing, pretty obvious, is loose skin. As we get older, our skin gets looser and it can sag. The second thing is we can develop loose muscle. There's a muscle called the platysma muscle, which is a sheet-like muscle in the neck that extends up the neck over the jawline into the lower face. And as we get older, that muscle can actually droop. And as it droops, it creates these little platysmal banding. And you may see that loose muscle in friends of yours who are a bit older and they have thin necks. Sometimes you can see the banding, and that's basically loose muscle. But we can also develop fat that is drooping as well. And drooping fat creates jowls, but you can also get drooping fat under the chin that can be visible too. So, sagging neck skin typically has a combination of those three factors. The droopiness of the skin, along with drooping muscle, and even excess or drooping fat pockets. So, how can you treat it without surgery? Well, if you're in your 30s and your 40s and the droopiness isn't that bad, then you may want to try a non-surgical treatment. Here at YPS, the treatment that we offer is called ReFirme. ReFirme is a very mild, it's not a painful treatment at all, and it uses radio frequency to heat up the deep skin. By heating up the deep skin, it can cause that skin to gradually tighten, the collagen to actually tighten up. Now, once again, this is a very mild treatment. This is not something that creates a dramatic improvement. It's not a facelift by any means. But for those people who are in their 30s and 40s and even 50s, and they're just looking for that kind of modest tightening, and especially this is a great way to kind of maintain the tightness that you already have, then ReFirme is a great option. Typically with ReFirme, each treatment takes about a half hour to 45 minutes. There's no pain with it. You may feel a little bit of warmth with it, but in general, it's not painful at all. You may have a tiny bit of redness afterwards, but usually not even that. We do recommend a series of treatments spaced every few weeks, anywhere from 4 to 6 treatments to get started with it, and then a treatment every few months to kind of keep the results up. Now, if ReFirme isn't aggressive enough for you, and you're past your 30s and 40s, you're in your 50s and even early 60s, and you want something more aggressive, then an option is called Ultherapy. Ultherapy is a treatment that utilizes ultrasound to heat up the deep skin more aggressively than ReFirme to cause that skin once again to tighten up. Like ReFirme, that does not involve surgery, it does not involve injections or needles or anything like that. Like ReFirme, it functions by heating up the deep skin, but it's a more aggressive heating. We don't have Ultherapy at YPS. If you're considering it, then I'm happy to refer you to a different office for that. We don't offer it just because this is something that, honestly, the results, I think, can vary. And the treatment can be fairly uncomfortable. It is fairly expensive, can cost upwards of a couple $1,000s. And the results, my understanding, are pretty variable. I've talked to some patients that had Ultherapy, and they said that it created a really nice change for them. And you can see, I'll point this way, you can see in the before and after photo from Ultherapy that you can get a pretty nice improvement with Ultherapy in the droopiness of the neck. But the problem with Ultherapy is not everybody gets that result, and I think that's where it's kind of difficult. Not everybody gets the impressive result that you're seeing there. And so if you're thinking about Ultherapy, I would encourage you to talk to the doctor who's performing it and really get a good idea of what that doctor thinks you can get prior to putting the money down and doing it. It may also be worthwhile asking them, well, what happens if we wait the several months to see the results and I just don't get anything? Is there any option for you to get your money back or a partial refund or maybe apply that money towards something else? So just for your knowledge, these are the two non-surgical treatments technically that I recommend for the neck area. Okay, but once again, if you're not doing surgery for the neck, you can get some change, but it's never the same as an actual facelift. Okay, so let's talk about surgery. If you are in anywhere from your mid-40s on and the looseness is quite severe, then your best option is a lower facelift. This is a very popular procedure in my office. I probably average anywhere from probably about a facelift every week or so. But this is real surgery, okay? And let me describe how the surgery works. Basically, it's a general anesthetic, so you're completely asleep. And while you're asleep, I make an incision starting at the top of the ear. I'm going to kind of come in close so you can see it. But the incision starts at the top of the ear, goes in front of the ear, just inside the tragus or the cartilage of the ear, and then extends in front of the earlobe. And then the incision extends in the crease behind the ear, way back here where you can't see it, over and then down in front of your hairline. Now the length of the hairline, the neck incision, and that scar really varies depending on just how droopy you are. If you've got a real droopy neck, then that scar back here, I will lengthen to try to get the optimal lift of your neck. If, however, the neck isn't that bad, then the scars can be shortened. And if you look at the diagram there, you can see where those scars are. This diagram is also in my book, The Age Fix, and you can find a similar diagram as well on this website, on my business website, dryoun.com, under the facelift section. So once we make those incisions, okay, and I do one side at a time, once I make that incision, then I lift the skin up off of the fatty layer. And then I remove the extra fat pockets from the jowl area, along the neckline, and underneath the chin. Okay, so we remove that extra fat utilizing a specialized one-sided liposuction device. The fat is removed, and that helps to contour that area. And then we take the muscle area, and I mentioned the platysma of that muscle, and I put sutures in that muscle to tighten that muscle up. And the way I describe it, it's like a hammock that has gotten loose. You tighten it up from the side to tighten up those muscles, and that will help with the loose muscles and with the platysmal bands. Now, after that is done, then we take the skin, re-drape the skin, and this is what people do in the mirror all the time to kind of look at themselves and how would it look with a facelift, but we re-drape that skin towards the ears, and utilizing those incisions, I can cut that excess skin out. So by doing that, you get a nicer, sharper jawline like you see in this diagram. But what you get afterwards, however, are permanent scars. And those scars, once again, they go in front of the ear, just inside the cartilage of the ear, in front of the earlobe. They extend in the crease behind the ear, over, and then down. Now, if you're a male, we typically will put the incision not inside the tragus or that cartilage, but right in front of it, just because we don't want the sideburn to be moved up over that cartilage-bearing skin. Okay, and so for the male, it's a little bit different, but pretty darn similar. Okay, so we lift everything up. You have the incisions that we close up there. Afterwards, there's a little drain that goes behind each ear. Okay, and then we put a facial wrap that comes up like so. And that is just to help provide some compression. Now, after surgery then, once again, it's a general anesthetic. The surgery takes about anywhere from 3 to 4 hours, depending on how much needs to be done. After surgery, you do go to the recovery room for 1 to 2 hours, and then we bring you up to your room at the hospital. Now, I typically do these surgeries at Beaumont Hospital in Troy, and we do keep you overnight that night to monitor your blood pressure and to make sure everything looks good. So, you go up to the room that night. The nurses will help get you up and walking to prevent blood clots, okay? Because it's a bit of a longer surgery, there is a small risk of blood clots, and we got to get you up and walking to try to prevent that. Now, that night, you do some walking. You've got the little drainage tubes. You've got your facial wrap. You're going to look and feel a bit tight. I want you to feel tight. I want you to know that we did something, because no matter what, things will relax with time and they will get a little bit looser. No matter what I do, no matter how much I tighten you up, they are going to relax. The next morning, either I will see you or my PA, Devin, will come see you in the hospital. We'll take your drainage tube out, make sure everything looks good, and get you going home. Now, this is typically not a real painful surgery. Most patients may take a couple of pain pills the first few days, and that's usually about it. Okay, so not a real painful surgery, but you are going to feel tight. You're going to look tight. You may get some bruising as well. You come back to the office at about 1 week, typically day 6, and we take the majority of your stitches out, make sure everything looks good. Okay, at that point, you don't have to wear that facial wrap anymore, although some people will wear it at night just to protect their ears. Then you come back to see us about a week and a half later. Now, usually people will be driving a car within about a week and a half after surgery. So you come back to see us at about 2 to 2.5 weeks. We take the remainder of your stitches out, make sure everything looks good. Usually people will look pretty presentable within a week or two. And you should look good, hopefully, within about 2 to 3 weeks, where you can look in the mirror and say, wow, I think I'm really liking what's going on. You can start exercising at 3 weeks after surgery. People typically go back to work anywhere from 2 to 3 weeks after the procedure is done. We do recommend, you do find that the swelling, initially most of it's gone after about 6 to 8 weeks, but it can take a full 4 to 6 months for all the swelling to go away. And those scars will be permanent, and they can take anywhere from 6 to 12 months for those scars to completely mature. So that's kind of the recovery of a lower facelift. You got to keep in mind you've got those scars, and you also have a little scar underneath the chin that usually heals real nicely. Now, what are the risks of surgery? Okay, the first thing is you're going to have scars, and there are risks that those scars can get thick, they can get wide, they can even turn into keloids, although that's quite uncommon. So the first thing, once again, is the risks of thickening of those scars or widening of those scars. And one thing that we recommend is starting scar creams, usually about 2 to 3 weeks after surgery. If there's any sign of early thickening or of those scars, then we would recommend starting a laser treatment at that time. Worst case scenario, we can consider injections of a steroid. Other risks of surgery, bleeding. That's why we keep you overnight in the hospital to monitor for that. That risk is probably 2 to 3% or less. There's a risk of infection, which is very low risk of that. There's a risk that you may find that things kind of loosen up a bit, a little bit more than you want. A lot of the tightness of a facelift afterwards really depends on the quality of your skin. And what we find is I've done a lot of husband and wife facelifts, and typically women take much better care of their skin than men do. And for that reason, women who have facelifts typically have a longer lasting and a tighter and a nicer result than men who have facelifts. Okay, and so there is a chance that things are going to recur a bit just as things relax. Much higher risk of that in men than in women. Other risks can involve numbness. Everybody's going to have some numbness with this surgery. Numbness with a facelift is an expectation, not a complication. However, that numbness typically goes away, but there's always a risk that some of that could be permanent. What we do worry about, however, is damage to a motor nerve. And there's a nerve called the facial nerve that runs along the jawline and comes up to the corner of your mouth. And there is a definite risk of that nerve getting injured. And if that's the case, you can usually get a crooked smile out of it. Now, if that nerve is injured, which is extremely rare, 99% of the time that nerve will come back. And so nothing to worry about, but it may take some time. Once again, though, this is a very, very low risk of something like this happening. There are other risks. If you're a smoker, you have risks of the skin actually dying and poor scarring and that type of thing. So got to be off smoking for at least a month before surgery and stay off smoking for at least a month after. Okay, so I do not do facelifts on smokers. What are some other risks? Those are kind of the main ones. There's risk of blood clots. That's why we get you up and walking. Otherwise, those are some of the main ones, and we will go over the entire potential spectrum of complications and risks at the time of the consultation and or the preoperative visit. So that's kind of the gist of the lower facelift. Let's take a peek at some before and after pictures. You can see the drooping neck skin there and really tightening things up, improving the jowling. There are scars, however. Unfortunately, her hair is covering it right now. This also, you can see a big change in her neck and the jowling. A real nice change for her. Another patient, same thing. You can see that sagging neck really being lifted with the lower facelift. You can't get this type of result with non-surgical treatments. Unfortunately, the only way to get this is with actual surgery. And that's why there truly is no substitute for a good facelift. Another patient here, you can see a real nice change, a big change in the neckline. Once again, Ultherapy won't do this. Really the only way to get this type of result is with a lower facelift. And so if you've got sagging neck skin, you've got a couple of options. If you're in your 30s and 40s, then try something non-invasive and really simple like ReFirme. We have it in our office. It's not that expensive, super easy to have done. That can work real well to kind of keep things nice and tight. If you're noticing things starting to loosen but you don't want surgery, it's not that bad yet, then Ultherapy may be an option. We're happy to refer you to a local office that has that. But if you've really gotten things kind of droopy, you're in your at least your mid-40s and older, and things are really drooping, and you want to get that dramatic wow improvement, then the idea is a lower facelift. I hope this has been helpful for you in deciding what is best to treat your sagging neck skin. Thank you for watching.